I want to make a distinction between a universal plan versus a single-payer plan, because those are two different things. A single-payer plan would be a plan like Medicare for All, or the kind of plan that they have in Canada, where basically government is the only person, is the only entity that pays for all health care. Everybody has a government paid-for plan, even though depending on which country, the doctors are still private or the hospitals might still be private. In some countries, the doctors work for the government and the hospitals are owned by the government, but the point is that government pays for everything, like Medicare for All. That is a single-payer plan. I have not said that I was a single-payer supporter because, frankly, we historically have had an employer-based system in this country with private insurers, and for us to transition to a system like that, I believe, would be too disruptive. So what would end up happening would be a lot of people who currently have employer-based health care would suddenly find themselves dropped, and they would have to go into an entirely new system that we had not been fully set up yet, and I would be concerned about the potential destructiveness of that kind of transition. All right? So I'm not promoting a single-payer plan. I am promoting a plan that will assure that every single person is able to get health insurance at an affordable price, and that if they have health insurance, they are getting a good deal from the insurance companies. That's what I'm fighting for.
The challenge is, how do we get the federal government to take care of its business? I happen to be a proponent of a single-payer universal health care plan. That's no reason why the United States of America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. And that's what Jim's talking about when he says everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back